You're listening to
CRST,
the podcast
from Bryn Mawr Communications.
Well, welcome everyone to another episode of CRST, the podcast. And today we're going to have a really interesting discussion about sustainability. I'm John Hovanesian. I'm a surgeon in Southern California, and I'm joined today by one of my really very favorite people in eye care for lots of reasons, the brilliant Dr. Emily Schehlein, who practices in Ann Arbor, Michigan, to talk a little bit about sustainability, EyeSustain, and why and what she is doing to help us move cataract surgery in particular to more sustainable ways of doing things. Emily, welcome to the podcast.
Thank you so much for having me. What an introduction. I'm going to have to save that recording so I can refer back to it.
Well, it's all true. And so, Emily, EyeSustain has been around for just a couple of years now. But first, tell us about yourself, your practice, what you do, and then how you first got involved in sustainability and eye care.
Absolutely. So, as you said, I practice in Michigan. I am a glaucoma and cataract surgeon in private practice. Graduated fellowship from Wilmer and did my residency at University of Michigan. And they lured me back here. It's a wonderful state to live in. But I actually got my start in sustainability several years ago. I had the opportunity to work with Cassie Thiel, who I think we all know and admire greatly for her work in this part of healthcare. And we did a project that it ended up being published in the Journal of Cataract and Refractive Surgery in 2017. And what we did is actually a waste and life cycle assessment of cataract surgery. And we compared that from the Aravind Eye Care System in India to several other cataract surgery locations across the world. And what we were able to do is actually collect waste performed in cataract surgery. So at the time, I believe I was actually a medical student when we did this project, and I was on my away rotation at University of Michigan and also at my home institution, which was University of Maryland. And I was actually collecting trash in the operating room. So just imagine you're an attending surgeon trying to get your surgery done, and there's a little medical student running around kind of collecting and weighing trash. So, if there's anything that's going to kind of thrust you into cataract surgery, that's definitely a good one. And
Way
so,
to get noticed there, Emily. That's great.
I mean, really, they loved me, and they probably were a little annoyed as well, but it's okay because we ended up getting some really valuable information out of it. So really, my first introduction to ophthalmology was looking at the amount of waste that we produce. And so it's something that has always kind of stuck with me. And this paper, I think, is one of the ones that we constantly refer back to when we talk in EyeSustain and when we write our position statements and when we talk about the need to reduce waste, because it really showed that in many developed countries, we use a lot of waste, and we produce a lot of waste through cataract surgery. And when we compare that to more sustainable institutions, for example, the Aravind Eye Care System, it's really such a massive difference. And so kind of from that, knowing Cassie and really being interested in this space, I was able to get involved in EyeSustain. And I think we've really expanded upon that. And it's been a wonderful experience. And I think we've all learned a lot.
It's amazing when you go into medicine, you haven't had any exposure to what happens, particularly in the operating room. Initially, I think for all of us, it's a little shocking the amount of waste. And, we all become numb to it. But when you step back and look at it, we all sort of agree this is a problem. In fact, David Chang also did with Cassie Thiel. Cassie is a faculty member at NYU who's a PhD scientist who studies really surgical waste among other things, and she's really the academic on this subject area. But she and David Chang published this great article that surveyed 1,300 cataract surgeons and nurses, and 93% of us, not surprisingly, believe that there was excessive OR waste, and about 80% believe that we should reuse more of the supplies we use, and we're concerned about global warming. And there was a strong desire from about 90% to have medical societies advocate for reducing the surgical carbon footprint. And now that's really, that was, I think, David Chang's wake up moment to start EyeSustain, and you got involved. And a number of things have happened since then, including a really pivotal multi society supported paper that you published, and I was a co-author with you on the subject of the directions for use or instructions for use that go inside packaging. Can you talk a little bit about IFU, what they are, and unpack that paper a little bit for us?
Absolutely. When I think about starting this process of writing this position paper, I go back to that time when I was a medical student and I didn't know what anything was. I didn't know what the lid speculum was. I didn't know how many different kinds of choppers there were. And so all of my questions really came from a place of true curiosity and learning. And so I remember them opening the lens. And, my first question was kind of like, well, what's the lens? We've moved beyond that now. But my second question was, well, what's that booklet that's in the box with the lens? And I'm asking the circulating nurse, and she's kind of not really knowing. She's like, well, it has information about the lens in it. And I said, well, okay. And then I asked the surgeon, and they kind of said, well, yeah, it has this information about the lens, but nobody looks at that. So then I kind of and it's true, if you look back at your surgeries, how many times are you looking through that pamphlet? So then I became a surgeon myself, and I thought, well, there has to be a reason for this, right? There's going to be some time in my surgical career that I'm going to look at this pamphlet. There just has to be a time. And there really wasn't, right? Because as a surgeon, you're really going to be prepared for your surgeries. And so being prepared for your surgeries means that you're going to know about what's in that instructions for use packet. And I think we all know what this is, but just kind of to say that this is an instruction for use for materials in cataract surgery. So it is comes with IOLs, insertion cartridges, viscoelastic, irrigating solution, phaco tips, sleeves, and it really just has information about those particular items. So, indications, contraindications, precautions, all of these things. And that sounds really important. And so, I really thought, okay, there must be a time where I'm going to use this, but really there was not. And so when we kind of started talking about, well, what are things that we can do that are easy and make sense to reduce waste, this was really at the top of our list. Because the reality is, when you actually measure the amount of waste that is produced by these instructions for use, it's a huge part of the packaging. And I think you actually wrote a paper about this or did some study about this, John, where you actually looked at the amount of waste that is produced by the IFU. But there's many papers that are about this. So for example, a 2023 paper, Stern et al. Said that reducing the paper IFU could lead to an 84% reduction in paper. So that's preserving more than 2,000 trees or 50,000 reams of copier paper each year. So this is a huge amount of waste that we're talking about for something that really no one is looking at intraoperatively and could easily be transferred to an electronic form.
Yeah, no question. And when you look at the packaging, really the IFU, that piece of paper, is responsible for the size of the box, which, for those not familiar, an IOL box is usually about the size of a DVD case, or maybe a little bit smaller. Now that I said that, I wonder if all our listeners know what a DVD is. Uh, oh my. but, but so a small book, small paperback book, let's just say, and the paper you were referring to that I was involved in was with Andrew Kaiser, was the first author, a medical student in the Bay Area, who measured all the components of an IOL box except the IOL, because that part we know doesn't go to waste. The rest is all waste, right? And plastic components, paper components, the little wagon wheel, we call it, that the lens is delivered in, and about half of the weight of the package is the IFU, as well as it's responsible for much of the other weight for the reason I said, because it's really the biggest thing in the box. It's printed in multiple languages, printed in tiny print that nobody can read anyway. If you wanted to read it, you'd look it up online, where you'd find a more current version of it. and so And actually take us through, if you can recall, some of the other elements of the logic of why this just simply should be electronically delivered rather than on paper.
Absolutely. I think, one of our fearless leader who also was very involved in this position paper and is, a creator of EyeSustain, David Chang, he always has such a great way of thinking of things, which is why are we doing what we're doing? And if there's a great reason for it, then great, it must be important. But if not, then there's possibility for change. And in this case, possibility for waste reduction. And so in this case, I think our question when we were structuring our argument to make this transition was, why are we doing it? And the answer was that people believe that there is some type of safety component to having these paper instructions for use. And the thought is that perhaps a surgical facility may not have reliable internet or LTE access to be able to access this information, which we were able to expand upon in our paper. We want people to be able to access this via QR code on the box. And the vast majority of institutions and hospital systems do have either cellular access or reliable internet connectivity. But of course, if they did not, then it would make sense to at least have the ability to download it on the website or request just one printed copy from the company for these materials that we use over and over and over, the same materials with the same information. So we made that argument, and I think a lot of what you said about, you know, that we really aren't able to use the IFU in the surgery if we even wanted to, because the print is so small and we're often in this dimly lit operating room, and also, if we get to the point where we need to reference the instructions for use, we probably should really already know what they say. We're scrubbed in, the IFU is actually sterile. And so, typically, as a surgeon, in preparing for your surgery, you're already going to know the information that is in that packet. But I think another thing that we kind of talked about was the our partnership with industry in this. So when we have spoken to our industry partners about this transition, it makes a lot of sense for them because they are able to actually reduce their packaging weight. And one company actually was able to facilitate this in areas where it was allowed, and their IOL packaging weight was reduced by more than half. So it makes sense for them because they are able to actually save money and they are able to be more efficient in their packaging and shipping. However, they are very limited by regulatory agencies. And again, with the thought that electronic IFUs or the transition from paper IFU to electronic IFU could have some harm in patient care. And that's kind of where those regulatory agencies come from. But we know that that is not true. And that is really our argument in this position paper. And so, what we were able to do with the help of our industry partners is really look at exactly which countries were allowing instructions for use to be transmitted electronically, and our goal is to identify those countries that do not, and sort of try to start this grassroots activism, right? Where we have our iSustain meetings, we have different physicians and representatives from regulatory bodies participating in those discussions so that we can really start to have the agency to make change and allow them to make this very sensible change from paper to electronic instructions for use.
Give some examples, if you would, of countries that are supportive of this, because as you point out, not all countries are, and those that are not supportive of electronic instructions for use.
Absolutely. I think we got to look at the biggest market. And for example, in the United States, this is allowed. And in many places in Europe, this is allowed, although there is one caveat there, which I'm sure that we'll cover. But our largest market, really, where the EIFU is not accepted is China. And this is, in talking with our industry partners, this is kind of a stopping point for them because in order for them to kind of ship these materials, they have to have two separate manufacturing lines, and that becomes very onerous for them. And if we could all make the transition globally, then it would be much easier for our industry partners to make that transition fully from paper instructions for use to electronic instructions for use. And I don't know, John, if you want to talk a little bit about the MDR and kind of how things are going in Europe right now.
Yeah, well, I think you're welcome to touch on that, and it's a little bit complicated because while IOLs in Europe are allowed for to have electronic IFU in general, not all medical devices are, and not all drugs are, even when used in a professional setting. Um,
Exactly. And I think that iSustain has really drawn attention to this. And you've mentioned David and Cassie's survey quite a few times here. And there are surveys that are ongoing like that in other parts of the world. And I think kind of understanding what physicians and what our industry partners are interested in and believe in and support is really important. And I'm proud to say that iSustain has kind of helped to facilitate that and hopefully will make a significant change in this area.
Taking this a little more broadly than just instructions for use, the IFU is a great topic because it's one where everybody wins. Manufacturers win, we win, the environment wins, and patients don't suffer any harm at all for all the great reasons you just outlined. But there are other areas that also offer opportunities for us. Packaging beyond just the IFU is also a problem. There's a lot of packaging that probably could be reduced. You want to talk about surgical drapes? A lot of institutions use surgical drapes that cover the entire body.
Yes, there's so many opportunities for waste reduction. Obviously, in cataract surgery, there's no need for a full body surgical drape, and we have position statements from regulatory bodies and data that supports this. When we think about waste as well, one thing we can talk about is intravitreal injections, of which millions are done per year, and there's a huge amount of waste and packaging involved in that. And so there's definitely opportunities in basically every part of ophthalmology to reduce waste. But I just kind of wanted to call attention to something you said in your article, John, which is um, sustainable practice can have widespread sustainable practices can have more of a substantial impact than perfect sustainability practiced by only a few. I think that is so well said. And I think when we think about all of these different areas, it's important to understand that it's not going to change overnight. And we can't automatically have our industry partners and have our organizations immediately flip the switch and make a change, but it's these small baby steps. So, for example, with the electronic IFU for IOLs, that is kind of the example that we used in this position paper. And then we can apply that to different um, types of things that we use in cataract surgery and then to different parts of ophthalmology as well. So I think it's just important to note that this isn't an all or nothing type of thing. This is something that makes sense for individuals, for institutions, and globally. And we're going to encourage change and roll it out in a stepwise fashion.
This always brings up the question of what can you do when folks start talking about sustainability and realize that there is opportunity to make change. The next question is, okay, how? What can I do? It's nice to know that iSustain is advocating for this, not just locally but globally. It's nice to know that now 54, national eye and international eye societies have signed on as being collaborators with iSustain. But what can I do? And you want to talk a little bit about the iSustain pledge?
Yes. So, one of the things that is in the very beginning of our website, which we encourage you all to visit, and we will definitely put the link with this podcast, is taking the iSustain pledge. And what that means is it's a pledge that you can take individually, or your hospital system or your ASC can take, just to say, I'm going to do something about sustainability. And we have different areas of the pledge that you can look at, and it will give resources to you and your administrators and anyone else that is working with you, to basically say, I'm going to make at least one step forward in waste reduction in my institution. And certainly there are multiple steps that you can take. And the pledge is really quite detailed in terms of the resources that it provides. But it's really just a way to say, this is important to me and my organization, and I support it. But I think that when people ask me how they can get involved, which they do all the time, the first thing I really say is help us with research, because the way to change regulatory barriers is with clinical research and surgical research that shows that many of these things that we are doing are either positive or they're not dangerous or that they will reduce waste, and also research to show exactly how much waste that we're producing, because we all know that, but once we have actual evidence of the problem, it strengthens our argument to make change. And then the next thing I would say is to get involved with your local organization. So if you're in the United States, your state organization, your ophthalmology organization in whatever country you're in, because we really need grassroots activism. We need people to go to regulators and go to governmental institutions and say, hey, this change makes sense. This will reduce waste. This will reduce carbon emissions. And I believe in it, and my organization believes in it, and I would like to talk to you about it. And the last thing is probably education. And I think that EyeSustain has done such an amazing job on their website with giving people resources. And so we really encourage you to visit our website, and you can download information, you can learn yourself and pass that on to your residents, to your medical students, to your office manager, to your hospital or ASC administrator, because a lot of times barriers to change are really just knowledge. And once you have that knowledge to take even just that one baby step to say move from a full body drape to a half drape, that's when the change is really going to start to take place.
Yeah, I couldn't agree more. And honestly, the surgical facility pledge is something that any institution can take. It's designed to really sort of click all the boxes in terms of both saving you the amount of waste you're producing and in many cases save money. So just starting step one of the pledge is just educate surgeons and staff about sustainability and the impact of OR waste. Get people starting to think about it. Regularly evaluate things like your surgical packs. What is it in there that you're not using for every case? If you only use that 60 cc syringe to flood the conjunctiva once every 20 cases, well, don't include it in every kit. That's a lot of plastic you're throwing away. It deals with medication bottles and as you said, draping and so on. There are a lot of different parts of the EyeSustain pledge that really make eminent sense and are easy to do. And so we encourage everybody to go to eyesustain.org and you'll find the pledge there and sign up and take the pledge, and you can be on our pledge wall with the other practices that are trying to make a difference for the environment. There's lots of opportunity for people to get involved locally and even globally through EyeSustain. Well, this has been a great conversation. Emily, thanks very much for being part of this podcast. It's clear that, we've got a long way to go with certain steps. Certain regulations are going to just take time. But we need to continue to collaborate. We need to continue to make efforts. And folks who are leaders in sustainability like you, Emily, are just really helping us move into the future, confidently looking to save the planet, or at least do our part.
Thank you so much, John. And of course, you are such a leader in ophthalmology globally and nationally. And we are so happy to have you be a part of EyeSustain and just really pushing things forward in a way that only you can do.
Thanks, Emily. And thank you, listeners, for tuning into this episode of CRST, the podcast. We hope you enjoyed it and look forward to seeing you again in the future.
For more shows like the one you just listened to, check out the podcast channel on itube.net.